I'd like to talk about community resources. Community resources are important to help support the family and their person with Alzheimer's disease. Service needs will be unique for each family based on the situation, family or care partner's availability, and their involvement. Some families have many local family and friends who are willing to pitch in and help with care, while other families may have little or no extended family support and may need to rely more on local resources. Community resources can assist to support the physical, emotional, and behavioral changes that occur through the course of the illness. At some point, families may have to consider a different living environment for the person with dementia. Care needs can increase and change, and the safety and care of the person with dementia is important, as is the well-being of the care partner. Community-based services like InHome Care are often the first step in the continuum of care options. An in-home care attendant or a paid caregiver can provide care in the home for several hours, even 24 hours. Payment sources can include things like private pay, long-term care insurance, or Medicaid long-term care funding. When hiring somebody, it's important to think about what kind of help you're really seeking, so that you can clearly communicate that to the caregiver. For example, is it to spend time with your person, or do you really need help with more difficult situations like bathing and grooming? Or do you need someone to help with light housekeeping assistance or even prepare some meals? Adult day health care is another type of care that's offered. The semantics on this one can be really important. A volunteer activity or an adult social program may go over better with your person. One center began using the term life enrichment to make their services sound more appealing. This is really a structured program that provides support as well as assistance during the day. They're designed for activities, supervision, and companionship. Care can be useful in two ways. It offers respite and social stimulation. Often the best caregivers find keeping their person stimulated with appropriate activities very challenging. So this offers a solution. Attendance can be all or part of the day, or for all or part of the week. One son, who was caring for his mom at home, had her in adult day programming 5 days a week so that he could continue working. Payment sources for this program can be private pay, long-term care insurance, or the Medicaid long-term care plan. Another community-based service that can be very helpful are dementia support groups. They help boost the emotional needs of the caregiver. They also provide practical strategies for difficult situations and offer social connections. Early memory loss support groups include the person with Alzheimer's or other dementias. Those are typically offered free at various times and locations. As each person with dementia is unique, so are support groups. So if you don't feel quite right or fit into one, try another. Professional advice can be really helpful, but advice from a caregiver who's been there can be invaluable. Hospice or palliative care is really to address end-of-life care needs. Hospice provides comfort and compassionate care in the later stages of a terminal illness. In the early phase of the terminal illness, a rigorous treatment approach might be appropriate. But at the end phase of dementia, we really focus much more on the comfort care approach. The focus is on the care of the patient and their caregiver and family. Care can be provided anywhere, whether it's in the home or to supplement services of a residential care facility. And hospice services are a covered Medicare benefit and can supplement the services that are already in place. Medic Alert, or the Safe Return program, is offered by the Alzheimer's Association, and scholarships may even be available, so check in with them. A secure bracelet with identifying personal and medical information can help with wandering. We want to put that in place before episodes of wandering occur. We want to use a proactive approach to ensure safety. We know that more than 60% of people with Alzheimer's disease will wander. It's advisable for the caregiver to also wear a bracelet. It makes it more comfortable for the person with dementia if the caregiver also wears a bracelet. In addition, if the caregiver were to be in an accident, for example, emergency personnel would know that they have a person with dementia who needs care at home. For more information on Medic Alert and the Safe Return program, please visit the website on your screen.